you're saying like if you have low pressure, that means less oxygen. But could you, if you have, like, let's say you have.
Just means you're kind of cool like me.
See, if you have like COPD, would you have lower blood pressure, something like that, or?
Not necessarily. The difference is the perfusion of the oxygen to the tissues changes.
When you're an athlete, though, your blood pressure is usually lower.
Yes.
So why is that not bad in that scenario?
Because just like anything else in your body, the heart is a muscle. It is a muscle, believe it or not, that can be trained. So people who do exercise regularly, all right, and they do it on their consistent basis, okay, they are training their heart. And therefore, the heart becomes more effective. It becomes a better operating organ. So if we think about the blood pressure, the norm, okay, one of the things that's going to happen, the body wants to make sure that that blood pressure stays within that range. So throughout the body, we're going to see receptors, we're going to have an integrating center, and we're going to have an effect. So receptors, what we're going to say, we're going to term this a baroreflex, because what we're having is a reflex. Now, in the arteries that branch right off of the heart, okay, we have stretch receptors. So think about how, if that blood pressure were high, that means a stronger push out of the heart. That's going to create more of a stretch on the arteries, and these receptors will pick it up. When they do, they're going to carry that stretch information to the central nervous system. The central nervous system is now going to integrate that information. And then the response, look at this, comes down through the vagus nerve. What was that?
All the time.
What, what?
Isn't that the largest nerve?
Yeah, sort of.
Controls everything.
And it's kind of long.
I was going to say control everything.
Well, sort of, yeah, because it's going to touch all those viscera. But what I'm trying to get you to tell me, it was a cranial nerve. So, my response from this internal viscera is traveling by way of a cranial nerve. Now, the goal, once the receptor picks up the stretch and it sends the information to the integrating center. Now look at what we got right here. Oh, whoa, wait a minute, what's that? Another cranial nerve. And it's, what? What's this? A primitive part of my brain. It's in my brain stem. So the information goes to my brain stem where it processes that information, and then I have to send the effect out. So it's going to come by way of the vagus nerve, and it's going to come in, look at this, and have an effect on my cardiac pacemaker, the SA node. which is going to be something totally to the heart. It's really cool. So this is negative. Negative wanted to bring the blood pressure back to normal. Now, if this had been a positive feedback loop, what would happen? It would keep going up. So, blood pressure keep going up and up until the point where if the body can't meet the demands, it'll stop. And remember, ultimate source of death, no matter what the case, is the heart stops. The two divisions of the autonomic nervous system. We've got a sympathetic division. It is not sympathetic at all. Okay? When I hear the term sympathetic, I think of something being, I'm so sorry, this happened. Is there anything I can do for you? Okay, that's what I think of with sympathetic. Oh, no. This time, sympathetic is going to be like, y'all ever seen that little picture about, you know, it's like two old ladies or whatever, and one of them's, you know, carrying the bat, and it's like, okay, you know, a good friend come bail you out of jail. Your best friend's going to be swinging beside you with the bat going, somebody's going to get it. You know? So, this is sort of what's going to happen, okay? Sympathetic division's going to be like, oh, yeah, you think that's happening? Oh, come on. We're going after this, okay? So, the sympathetic division keeps it going, all right? Gets it ramped up. So, what it's doing, like I said, we are preparing to either fight or flee. So, this could be exercise. Now, granted, if you're not a regular exerciser, don't expect to leave class today and go run 10 miles. All right? The body is not going to meet those demands. Okay? But if you have your regular routine, yeah, you'll be good. Trauma. In a time of trauma. Now, whether this could mean you yourself were physically hurt or someone you love was physically hurt, the body still gets ramped up. Okay? Arousal. Like, for example, when you see your mate. All right? Lots of things go on in the body that are based on sympathetic. For example, the pupils dilate. Whether the light doesn't affect it. If it's your true mate and true love, the pupils dilate. And you don't even know it. It's kind of cool. Competition. Now, granted, in caveman days, yeah, there was competition for food, water, and shelter. Okay? We supposedly have our civilized society now. In times of anger or fear, it's preparing your body for all of this. We increase the heart rate, the blood pressure, the airflow, glucose levels. So many things happen that it would boggle your mind. But look what we reduce the blood flow to. We reduce blood flow to the skin and the digestive tract. We need to make sure that we are channeling the blood flow to the core of the body and to the muscles, the skeletal muscles, to prepare to either fight or flee. Well, when this starts kicking in, this other division, the one that's sympathetic, the parasympathetic one's like, hey, whoa. We need to calm down here. All right, so let's calm down. Let's decrease that heart rate, decrease the blood pressure, decrease the airflow. You know, I need to go and digest this breakfast you ate, blah, blah, blah. You just need to calm down. All right, so that's what the parasympathetic wants to do. So think about an organ in your body having this one fiber coming in, trying to be sympathetic. And then you got another one coming in, for the most part, that'll try to be calm down, parasympathetic. This is the case, okay? So what you're going to see is that most organs are going to have that. Now, under normal conditions, because your body 24/7 is having to meet blood pressure, respiration, digestion, all of this stuff. This system is constantly doing this number. Yes, no, yes, no, yes, no. But it's kept normal. Okay? It's only in times when the sympathetic might have to work a little harder, parasympathetic might have to work a little harder. So under normal conditions, we maintain tone. Meaning, all right, blood pressure needs to go up a little bit. All right, well, come back down. Okay, stay normal. Respiration rate. We need some more oxygen in the blood. Make her breathe. Okay, we're good. She can stop right now. No, make her breathe again. Okay, so for the most part, that's what it's doing. We're keeping tone. So when we have a balance, okay, this is where we're thinking about the maintenance of that homeostasis. We're meeting that norm that they tell us about. That they're telling us, okay, the normal heart rate should be, it's usually about 60 to 80 beats, okay? And the people who are really good athletes, all right, like people who train for maybe like the Olympics or whatever, their heart rates at rest can be like around 40 because they are so conditioned, okay? I mean, it's crazy. I mean, it's like, wow. We're going to see that blood vessels and so forth will be kept at either constricting or dilating to meet the demands of the heart. So under normal conditions, okay, everything is pretty much on an even keel. Now, the sympathetic, when we excite the heart, something that's going to happen. If something occurs, we excite the heart, well, we got to stop something else. For the most part, when the heart gets excited, we're going to inhibit that blood flow and so forth to the digestive system and the urinary system. Now, under certain situations, that's necessary. For example,